Hello, mental health providers and clinicians. Today's subject has to do with, is the stigma of mental health getting in the way of you being able to provide services to more patients? Stigma is a really big issue. So many people will not go for mental health services because they do not want to be labeled with some mental illness. Other people, they welcome the diagnosis because it gives them an understanding of what was going on with them and how to go about treating it. But there's still very many people who really do not want to go receive these services. And we see this a lot with men who drown their worries and concerns, their negative thoughts in alcohol. And they're feeling depressed, as an example. So what do we do about this? Well, as far as I'm concerned, it is up to us to educate the public about why it is that their mental health matters. Because life sucks when your mental health sucks. It's really that simple. If you're feeling depressed, you have no energy to do anything. If you're anxious all the time, you get triggered with anxiety a lot. And a lot of times people don't understand why that's happening. Obsessive compulsive, oh my God, I've had clients over the years who couldn't do hardly anything. Because by the time it took just to get over the obsessive behavior. With all of it, it's all about education. But there's another problem that we have in that many of us are not willing to be open about our own history in terms of why we got into this field in the first place. And let's be really honest about the fact. Many of us get into this field, as I did, because of fighting our own battles with mental health. In my case, I had bipolar 2, which was actually diagnosed as manic depression back in 1989. It was totally cleared and gotten rid of. 5 minutes of timeline therapy, thanks to Had James, who developed timeline therapy, and told me what I needed to clear, and I cleared it and never looked back again. That was back in February 2004. So this whole idea that you have to take medications, synthesize chemicals your body doesn't even know what to do with, toxify the liver and the kidneys over time. And I did actually suffer from slowing down in my kidneys after being on lithium for over a decade. It was reversed because I was taken off of it, and it was okay, and is okay. However, we do need to take these things under consideration. We're thinking about the long-term effects of these toxic medications, especially when we're dealing with children for whom we don't even really know what the long-term effects are going to be with them taking these medications. The research isn't done. The pharmaceutical companies don't do the research on kids. So we don't really know. So let's stop pretending that we do. What we do know is that a lot of people can learn how to regulate their own emotions. Before all the psychopharmaceuticals came out, that's what people did on a pretty regular basis. We need to get back to that. So I talk pretty openly about my history and how I overcame it, and that gives hope to my clients that they too can overcome the symptoms that got them diagnosed in the first place. And I don't really care how challenging the case is, so long as they don't have psychotic features and so long as they don't have personality disorders, full-blown personality disorders. Because those two types of people I cannot help heal with hypnotism and neurolinguistic programming, which are my modalities of healing. After being appalled at what I witnessed in the supported housing venues that I worked at before I got into hypnosis and neurolinguistic programming, with the demeaning treatment of our clients, neglect, there was just a lot of really horrible things that were going on in the early 90s in the supported housing programs. I was lucky to be in a program where we had real professional people there who really taught me how to create healthy boundaries between myself and the clients who had a lot of very serious mental health problems, to the degree that many of them had dropped out of school before they graduated high school because of the symptoms getting in their way of being able to be educated. Those folks taught me so much in how to do this work. But this is the thing. We don't know what a person is capable of doing until we give them the opportunity to demonstrate it to us. And I had a client before I got into hypnosis and linguistic programming who had blue fingernails and blue lips because of prolixin he was court ordered to take for his psychotic features. He had paranoid schizoaffective disorder, was not allowing enough oxygen to get into his system, and not one person in that program who had worked with him for years at that point noticed it. I did, and I made sure. I went over my boss's head, and I got him into a better program for his psychiatric, psychological needs. And then I got him into a better program, period, that was a lot more structured because it was obvious that he needed and wanted structure, always asking to either become a Marine or be an astronaut, and telling his doctor when he went in for a med evaluation that he felt safer in a locked ward versus an unlocked ward because he knew the people who needed to be there were there and the people who didn't need to be there weren't there. It was pretty clear looking at it from his perspective. He taught me a lot. So I want us to understand that when we talk to our potential patients, clients, that there are people who've done amazing things, even though they had mental health issues. I know my ex-shrink psychiatrist talked to me about Ted Turner being a person with bipolar who did amazing things because the brain works so much quicker in the hypomanic state, but the trick is to not go into psychotic features, and how to understand the difference between those two things. And I also know of a psychiatrist and a nurse who both did a lot of advocacy in the mental health world in the Boston area, who both had schizophrenia. It is possible, but we need to be willing to help our patients and clients aspire to be the best that they can be and stop telling them what they cannot do, and they have to do what we tell them to do, because I'm going to tell you right here, right now, you don't know what they need to do in many cases. We need to shut up and listen. And when we do so, amazing, miraculous things can occur in the healing of our patients and clients. So if you're interested in learning how to apply hypnotism and neurolinguistic programming into your healing protocol, I'll leave my information down below. I do a 2-day VIP program. It's all done online with a 12-month mentorship so that you can actually learn how to apply this techniques with your patients as you are working with your patients. This is how I learned how to do it. I was calling Hawaii pretty regularly for the first 2 years that I was learning how to use neurolinguistic programming and hypnotism, calling my mentors and trainers, and that's how I got really good at doing this work. I don't know anybody else in the world of hypnotism and neurolinguistic programming training anywhere in the world who's offering any kind of mentorship, and that is the difference that made the difference in my learning how to do this. And I know that my other trainees were really happy that that was part of the programming because they have gotten really good. It's a mission of mine to really train as many mental health professionals as possible in hypnosis and neurolinguistic programming, because your patients do not need to suffer with depression, manic depression, obsessive compulsive disorders, anxiety. They don't, not even anorexia and bulimia and sex addiction. I've helped a lot of my clients overcome these things. I mean, overcome, not manage, overcome and move on. So if you're interested, my information will be in the description below. As always, I thank you for spending your time with me. Till next time. Bye-bye all.